And again, this is basically for the general public. Uh, One of the things I'd love to get your perspective, that is, what resources are out there for patient who, let's say, just diagnosed with melanoma? I mean, at this moment, in the book, we talked about, the mad rush phase from the time you get diagnosed to the time you get treated. It's a really kind of high anxiety, stressful time. What are resources out there?
Sure. Well, I think it obviously all depends on what the patient is going through and what their doctor is talking to them about. Is it something that they're just becoming aware of right now? Is it something that they were concerned about? Is it their first time perhaps with melanoma? Is it maybe their third instance of melanoma? So every patient reacts a little bit differently depending on the news. And I think from a resource perspective, it's everything from the immediate, right? Like we always consider physicians the first resource because they're the ones that are explaining things. At the same time, we also understand that when people are told that they have cancer, maybe they're not processing everything the same way, and they're dealing with the fact that they just were told that they have cancer, and they're not listening to the doctor as they explain some of the ins and outs, the details, maybe some of the risk factors, and maybe even some of the potential treatments. So our role as an organization at the Skin Cancer Foundation is to be that backup resource. Sometimes it might be a brochure, right? Sometimes it might be that the physician themselves hands them a brochure that we wrote that explains this is what melanoma is, or some other type of non-melanoma skin cancer. Here's what you need to know. Of course, people then will go back to their car or they'll go back to their apartment, and now they're still concerned. They don't remember what the doctor said, so they start to Google things, right?
Sure.
We consider ourselves that first stop beyond the doctor where people are going to be impacted the most. And they'll end up on our website, which is called skincancer.org. Or they'll end up on our social media channels and really start to dive in and learn about what it is that they're going through, more about the disease itself, more about the risk factors, potential treatments, and they can do that at their own pace. They can do it the next day, they can do it a week after, they can share that information with their family or their caregivers, and the idea is to be that support system of credible, medically reviewed information so the patient can get a little bit more peace of mind about their own situation.
You mentioned something really important. And like a lot of my patients come in and they find things from Google, and Google is great, but
Right.
there's some information just not accurate. And can you comment a little bit about how does your organization kind of validate and
Sure.
make sure the information is accurate?
Absolutely. So, it's the most important thing we do. Is credibility for us is paramount. We don't sell products. We don't have a lot of marathons and the type of events that a lot of nonprofits do. So what we do is we deal in information. So it's super important that everything we do is accurate and correct. Of course, to the limits of what we know, right? I mean, something that we might have said 10 years ago may not be exactly the same as it was or that it would be right now. For example, in around the year 2000, there were not a lot of treatments
No.
for melanoma. Immunotherapies hadn't really come out yet, right? But fast forward 20 years, there's lots of new drugs and drugs that have been used for the past 10 years. So true and accurate is always a time-sensitive type of a concept. So that's the most important thing we talk about. But when it comes to medical information, we are either having doctors themselves write it, or we're having doctors review information. So we here have employees that are in charge of our science and education group. They're in charge of our marketing communications group. We're constantly putting together new information based on voids that we recognize through the patients that we work with. And people want to know, I'd like to know more about this, or, I noticed you didn't have something like this available. So we'll go out and find the information through published journals and research studies and things like that, piece it together in a user-friendly way. So we're always very good at taking complicated concepts and boiling them down to understandable information. And then we go back to the doctors, whether it be the expert that wrote it in the paper or one of the doctors that works closely with the foundation, like yourself. And we'll ask you and say, look, does this make sense? Is this accurate? Sometimes when you boil things down that are complicated, something simple, you lose a little bit of accuracy. And we're always very careful of that. So we work directly with the doctors before we put out anything that's clinical. So
I've seen, I mean, there's a lot of publication that's coming out. Obviously, one good source is people can go is your website, right? But
right,
I know that you guys also put out a journal, Skin
yes.
Cancer Journal, but also there is a melanoma newsletter.
Mhm.
Is that still is
Yeah,
that
it's actually we're hoping to redo it. So we had something
okay?
called the Melanoma Letter, which was a quarterly newsletter that we did
That's
in
right.
for years. We haven't published it since pre-pandemic. It was one of the things that unfortunately was a casualty of the pandemic. And we're thinking about different ways to get it out in a modern way, right?
Got it.
So the print publications, there's a lot of challenges with that, from a cost perspective, from a time perspective, especially when information is so easily transmitted digitally. So we're looking at redoing that, but that's a good example of a product that we put out there that was intended to educate people, but right from the source. One of the most recent ones we did before we ceased publishing it, was an interview with James Allison, a Nobel Prize winner, who basically, started the whole immunotherapy revolution.
No, I always find, this is try to, the project is called Beating Melanoma. This is for
Right, of
helping melanoma patients.
course.
I looked at all the publications and the contents you put out. The melanoma letter by far is most in depth and rich content. I
Mhm.
would love to have you guys put this back on. And I think maybe after this conversation that we can put together some link and pamphlets so that other folks can go to it and
Absolutely.
exactly find this. So a couple of things.